went to the movies once with a girl that I was trying to impress back when I was a teenager. We were about to get food after the movie when she said that her chest started to hurt. Now, I thought maybe she just needed some fresh air or something, but she collapsed. People started gathering around and a commotion started stirring, and my body filled up with adrenaline, but I actually had no idea what I was supposed to do. Thankfully, somebody in the crowd stepped up and actually knew CPR. When they started administering aid, the EMT came, and these steps actually ended up saving my friend's life. Cardiac arrest is actually one of the leaders in deaths worldwide, and knowing CPR and being able to administer aid in such a short time can double or triple a victim's chances of survival based on the American Heart Association 2023. After becoming CPR certified myself and studying the processes, I can now share these life-saving tips with you. Today I'll inform you about the critical steps of CPR and the different situations and variations you may come across. First, I'll briefly explain assessing the scene. Then I'll go over explaining how to properly administer and apply CPR. And lastly, I'll explain the different variations and situations you may actually come across. First thing we should do when arriving in an emergency is checking that the scene is safe. There could be dangers present or hindrances that can cause harm to you or the victim or render your inability to even perform CPR in the first place. There can be fires, unsafe flooring, and crowded areas that can prevent these type of events. If someone else is present, tell them to call 911 and find an AED. If it's just you, call 911 and put them on speaker so that way you can continue administering aid. To begin administering CPR, you'll first begin with chest compressions. First, you will place your dominant hand on the person's chest at the center of their sternum. You will then overlap your other hand on your dominant hand and interlock your hands closest to the one on the chest, like so. Be sure to lock your elbows and place the heel of your hand at the middle of the sternum, like that. When giving chest compressions, you want to keep a steady rhythmic pace for 100 to 120 compressions, so that way per minute. Allowing the chest to fully rise after each push. For adults, the depth of compression should be about 2 inches, so about 2 of your thumbs. After 30 compressions, you will give a person rescue breaths. There's equipment available to avoid contact with a person, but if you do not have them, please use the following procedures. Open the airway using the head tilt chin lift method by slightly tilting the head back and placing 2 fingers on the chin and opening the mouth. Tilt the head back like so and like this. You will then give the person 2 full breaths, allowing air to fill up their lungs. You should watch to see if the chest visibly rises, and each breath should only last for about 1 second. Then you'll return to chest compressions for another 30 repetitions. You should continue this process until EMT arrives, and the system is made for a majority of people, but there are certain situations where there might be different variations that are necessary. CPR for kids is similar steps, but there are a few differences that are imperative for you to adhere to. When aiding a child, you should only need 1 hand instead of 2. And depending on the child's size, the compression depths will be the same 2 inches for adults, but make sure you're aware that you don't crush the child and press too hard on the child's frame. For infants, you will only use 2 fingers instead of 1 hand right below the nipple line. Also for infants, during rescue breaths, make sure you only fill up enough air to see the chest rise. You will not give an infant full breaths. Lastly, for women that are in pregnancy, there's one important change. The uteruses in late pregnancy can compress major blood vessels and reduce blood flow back to the heart. To fix this, you should either gently push or tilt the pregnant woman's belly to the left while performing these compressions. This is called the manual left uterine displacement method, and it helps improve circulation during CPR. There's one more thing I want to speak on before we get out of here and wrap things up. There's a law in place called the Good Samaritan Law, that encourages bystanders to help in emergency situations without fear of legal consequences if anything goes wrong. This is based on the 2023 article on the Stat Pearls, which is a medical and peer-reviewed reference. Today, we have covered vital life-saving steps that will be an asset to your CPR training should you ever need it. We have covered assessing the situation, calling for help, gone over performing chest compressions and rescue breaths, and what to do when you're aiding pregnant women and children. Proper CPR training can really save someone's life in any scenario and is imperative for you to know so that way you can improve someone's chances of survival. So now that if you see someone's life on the line and no one else is answering the call, will you be ready to act? Thank you.